They say medicine exists to heal, yet deep in history it sometimes became a weapon. Ancient doctors and healers carried out acts not of mercy but of cruelty, their tools sharper than compassion. Imagine lying on a rough stone table, staring at the ceiling, hearing only the scrape of metal against bone. These were not cures, these were experiments, and those who endured them begged not for survival, but for release from agony. Tonight, we uncover their forgotten world. Not in secret laboratories, but in temples, castles, and crowded marketplaces did these experiments unfold. They were whispered in villages, scribbled onto fragile parchment, and remembered in fearful silence. What made them terrifying was not only the suffering they inflicted, but the dread they created long after. For even the rumor of such treatments could silence an entire town. Tonight, we descend into those chambers where silence often roared louder than screams. To understand these experiments, we must first understand the world that created them. Before hospitals and modern drugs, healing was tangled with religion, superstition, and philosophy. A doctor could be priest, barber, or philosopher. Every illness was mystery, every cure a gamble. Yet patients were rarely seen as people, they were seen as opportunities. And in a world where pain was simply part of life, the boundary between medicine and cruelty was perilously thin. Have you ever wondered how it felt to live in such a time? Imagine a fevered villager brought before a healer. There were no painkillers, no guarantees, no promises of recovery. Only firelight, ritual words, and sharp instruments. Survival was never certain. Healing was not always the goal. For often, doctors sought knowledge, fame, or validation more than mercy. And so, every chamber of healing carried the risk of becoming a chamber of torment. And so torture devices and rituals of fear became tools of medicine. They were not used every day, yet their presence lingered like a shadow. A glimpse of an iron spike, a whisper of chains, was enough to terrify a patient into obedience. Doctors wielded fear as effectively as scalpel or saw. In this way, medicine became not only treatment, but control. The memory of screams muffled by stone walls was often more powerful than any cure. So let us step into those forgotten chambers. Here, pain became theater, silence became law, and devices of cruelty shaped kingdoms, cultures, and generations. These experiments were not forgotten because they failed, they were buried because they worked. They created obedience, shaped belief, and cast shadows still echoing centuries later. Now we begin the journey into the darkest stories of ancient doctors and the horrifying practices that left their patients begging for death. Our first stop takes us to one of the oldest and most brutal procedures known to humankind, trepanation. Long before anesthesia, long before antiseptics, doctors cut open the human skull. From the Egyptians to the Incan shamans, the goal was to release evil spirits, to cure madness, seizures, or headaches. Imagine a sharpened stone pressed against your skull, scraping bone away. The patient was awake, trembling, while the sound of bone cracking echoed in the room. Skulls unearthed from graves prove some survived, the bone edges show healing, but many more did not. Without sterile tools, without pain relief, survival was a gamble. The question lingers, was this medicine or the earliest human experiment? A desperate attempt to heal or a ritual of cruelty performed on those too weak to resist? Perhaps both. But for the patient staring into firelight as stone scraped bone, the difference did not matter. Now we move forward to the most widespread treatment in history, bloodletting. For over 1,000 years, physicians believed illness came from unbalanced humors, blood, phlegm, bile. The cure was to drain the body. Cuts were made, veins opened, or leeches attached. Imagine already being frail with fever, only to feel your strength ebb away with every drop. Many patients collapsed or died not from their sickness, but from the so-called cure itself. And yet, the practice persisted. Kings, popes, peasants, none were safe. For to question a physician was to defy both science and faith. Arrogance cloaked as medicine drained life from countless patients. The leech became the symbol of 1,000 years of misguided certainty. And so, I ask you, how many lives were lost not to plague or wound, but to the stubborn pride of those who believed themselves healers, while acting as executioners. But some of the most horrifying experiments were reserved for women. In ancient Greece, doctors claimed hysteria was caused by a wandering womb. Treatments ranged from forcing women to inhale foul smoke to fumigating the womb with herbs or worse. In Rome, women endured C-sections not to save mothers, but only to salvage unborn children. Their suffering was dismissed as necessary, their pain silenced by the authority of men who claimed to know better. These practices were not healing, they were control. Women became unwilling subjects in experiments masked as treatments. Midwives and healers were branded witches, while male doctors inflicted procedures with little concern for survival. What does this reveal? That medicine was never neutral. It was shaped by power and often used to dominate the most vulnerable. And in those chambers, every scream reminded the world who was considered worthy and who was not. Now let us step into Renaissance Europe, where curiosity and cruelty merged in a new stage, the anatomy theater. These were not hidden labs but public halls, where crowds gathered to watch dissections. Tickets were sold, benches filled, candles lit, corpses lay on the table, cut open for study. But whispers remained that not all bodies were lifeless. Some claimed criminals or the poor were used alive, dissected in front of audiences hungry for knowledge. Imagine the scene. Scholars scribbling notes, nobles applauding, citizens gasping at each incision. And at the center, a body sometimes dead, sometimes not. The line between science and spectacle blurred into horror. What kind of society applauds while one human suffers for another's education? And yet, without these theaters, anatomy may never have advanced. So I ask you, how much human suffering is acceptable in the name of progress? In war, experiments grew even darker. Surgeons on battlefields performed amputations at terrifying speed. Soldiers with shattered limbs were dragged into tents, laid onto bloody tables. With no anesthesia, no sterile tools, limbs were hacked away with rusty saws. To stop bleeding, some doctors poured boiling oil into the wounds, others pressed burning irons. These were not careful surgeries. They were desperate experiments, tested not on theory, but on living men still screaming. Some survived, crippled forever. Others died of shock or infection. For the surgeon, each patient became another test, another chance to try a new method. For the soldier, it was agony beyond imagination. Would you call this medicine or gambling with human lives? War pushed doctors to innovate, but it did so through the screams of thousands, sacrificed not only to battle, but to the ambition of those wielding blades in the name of science. Looking back, it is tempting to call these doctors monsters. Yet the truth is more unsettling. Most believe they were helping. Trepanation, bloodletting, anatomy theaters, amputations. These were attempts to understand a body no one fully understood. But in their ignorance they inflicted torments worse than the diseases themselves. Every breakthrough came at a price written in blood. And the patients who suffered rarely lived to see any benefit from their pain. So what do we make of this history? Medicine is a mirror of humanity, its compassion, but also its arrogance. Ancient experiments remind us that progress often demands sacrifice, but too often, that sacrifice was unwilling. So I leave you with this. When you take a pill today, when you step into a hospital, do you realize how many cries, how many failures, how many lives were broken to build the medicine we now take for granted? The story of ancient medicine is not simply one of healing. It is one of fear, of arrogance, of experiments that blurred the line between science and cruelty. These doctors left scars not only on bodies but on history itself. Their practices remind us that every cure carries a shadow, every step forward hides a trail of pain. And those echoes still whisper, warning us that progress without compassion can become as dangerous as disease. So the next time you think of ancient doctors, don't imagine wisdom alone. Imagine the dark rooms, the scraping tools, the boiling oils, the chains of superstition. Imagine the patients who begged not for life but for release. Their suffering was the foundation of progress, and yet their names remain forgotten. Tonight, we remember them, not as heroes of science, but as victims of experiments too cruel for memory, yet too important to be erased. As centuries passed, medicine advanced, yet the cruelty lingered. Doctors in the Middle Ages experimented with crude surgeries on prisoners and the poor. Herbal mixtures were tested in secret, with patients left to writhe when doses poisoned instead of cured. These were not experiments of mercy. They were desperate gropings in the dark, carried out on those society had already cast aside. For them, survival was never the goal, it was simply chance. In Renaissance courts, physicians tested potions on condemned criminals. Some were forced to swallow mercury or arsenic in the name of discovery. Others were injected with strange concoctions to test theories of balance and vitality. Imagine being chained in a chamber, handed a vial, told it might cure or kill. You drank because you had no choice. To the doctor, you were data. To yourself, you were nothing more than a body marked for ruin. Even the wealthy were not spared. Kings and nobles demanded treatments for every illness, and their doctors complied. Enemas of wine, baths of blood, bizarre diets of crushed gems all were prescribed. Imagine the terror of realizing your doctor's cure might be worse than your disease. Yet to refuse was unthinkable. The physician's word was law. And so, palaces became laboratories and thrones became deathbeds for those who trusted too deeply in flawed science. But the most haunting stories belong to those forgotten by history. The nameless peasants, the enslaved, the prisoners, all used as bodies for trial and error. They did not write their suffering into books. Their cries were not preserved in scrolls. Yet their agony carried progress forward. Their silence built the foundations of medicine. And so, I ask you, when you think of healing, do you also think of the countless nameless lives sacrificed in its name? Do you see the pattern? From skull drills to bloodletting, from boiling oils to poison potions, progress was written not in triumphs but in screams. Every so-called cure carried the weight of failure, and every failure was borne by a patient who had no voice. Medicine advanced, but at a cost so steep it is almost unbearable to imagine. The history of healing is also the history of suffering, intertwined so tightly they cannot be separated. And yet from this darkness, lessons emerged. Modern medicine remembers not only discoveries but mistakes. It remembers that without compassion, knowledge becomes cruelty. That without consent, healing becomes tyranny. The experiments of ancient doctors haunt us because they show what happens when power ignores humanity. Their legacy warns us. The line between healer and torturer is thinner than we wish to believe. Cross it, and medicine ceases to heal, it destroys. So what do we make of these ancient doctors? Were they pioneers or monsters? Perhaps both. They sought answers, but their methods left scars on generations. Their victims begged not for cures, but for death, and in that suffering lies a truth we cannot ignore. Science without mercy is brutality. Progress without empathy is regression. And history, if we do not remember it, has a cruel way of repeating itself in new disguises. One thing is certain. Every pill, every surgery, every cure we have today is built on a foundation soaked in pain. The nameless voices of the past whisper still. So when you picture medicine, do not see only white coats and bright lights. See also the dark rooms, the crude tools, the trembling hands of those who suffered, for their agony gave us our future. And perhaps that is the most haunting experiment of all.